Part two, picking up with our discussion of colon cancer and going over some risk factors, and specifically talking about age. There are instances where somebody can have colon cancer before the age of 50, but that's usually in somebody who's got a genetic syndrome where you're predisposed to having polyps and cancerous lesions develop well before the age of 50. Typically speaking, in somebody without any genetic predisposition to having a tumor, it takes decades of, even if you're doing a lot of stuff wrong with your diet and not having appropriate exercise and not eating an appropriate diet, it takes years and years and years of essentially harming your colon to induce enough cellular turnover in order to really damage your mucosa enough to induce tumor formation. So tumors before the age of 50, even without other risk factors, aren't super common. And then smoking is a risk factor. And that always trips people up a little bit because you're like, wait a minute, I'm not inhaling cigarette smoke into my colon. And that's absolutely correct. So I am not quite sure if that's a direct cause and effect, or if that's something that's associated saying, hey, if you're smoking, maybe you're not paying attention to the other aspects of your health that are more directly tied to your colon. And then also increased alcohol consumption. That's a risk factor for developing colon cancer. And that might be more directly related to smoking, that maybe alcohol isn't directly toxic to your colon, but that if you're consuming large quantities of alcohol, that you're not paying attention to those other markers that are directly tied to your diet. So symptoms. So this is what somebody feels, something that they would experience that's saying, hey, something's wrong, maybe I should go see the doctor. And so you got a couple things going on with your abdomen here, that you can have a lot of symptoms and that are going to be tied to colon cancer and the development of a tumor that you might push off onto something else that's saying, hey, I've got the symptom. It's going to be a lot more common to have with, other more benign medical conditions. And that's the first thing. The second thing is that your abdomen it's a large area. And even if you get a large tumor, even in your colon, your colon can adapt for a while and it can kind of hide a mass. And so it can get rather large before you're actually going to really notice that it's there. And so between the fact that the symptoms can overlap with a lot of other things that are not as worrisome, and the fact that your abdomen can hide things, that's kind of a two-hit scenario where you can kind of brush this off as maybe not being so bad, or that you're sitting on a time bomb that you don't know you're sitting on. So change in bowel habits. And so, if you're normally somebody that doesn't go to the bathroom very often, and you start going more frequently, or you flip that you normally have 2 or 3 bowel movements a day, and now you're not going for several days, that could be a symptom. Or if you just flat out have constipation, meaning that you're not going to the bathroom for several days, and when you do, it's hard, you're straining to go, your stools are hard to pass, that can be a sign of colon cancer. Or if you're having diarrhea, that can also be a sign of colon cancer. So you're having loose, watery, frequent stools. And it's weird to think about it, but all those things, and especially both constipation and diarrhea, can be related. And it's got to go back with that the model I wanted you guys using at the beginning of the year about tubes and dams. And we'll pick up there for part 3 in a minute. Thank you.